Today I will talk about pharmacy services. It is part of my series of lectures on hospital management. This is my lecture outline. First I will give introduction. Then I will talk about role of clinical pharmacy. Then I will briefly touch various acts in India. Then I'll talk about pharmacy in hospital, drugstore, OPD pharmacy. And then I will talk about pharmacy and treatment committee in the hospital, hospital formulary, and finally matrices and KPI in pharmacy management. So pharmacy is a premises licensed for related sale, supply of drugs to patients by a qualified personnel. Hospital pharmacy is responsible for demand, estimation, evaluation, selection, procurement, storage, compounding, and dispensing of drugs, chemicals, and other pharmaceutical preparations. Pharmacy is also involved in pre-packaging if required, quality control, research related to pharmacy, and dissemination of drug therapy information to hospital staff. So these two paragraphs briefly describe entire function of hospital pharmacy. It starts from demand estimation and it includes research as well as dissemination of information. Importance of understanding pharmacy in hospital management. It is important to understand pharmacy because it consumes large proportion of hospital budget. It is governed by strict government regulations and shortage of drug is detrimental to patient care as well as image of the hospital. Now let us see the role of clinical pharmacy. So it has administrative role, clinical role, educational role, provision of medicine role. So let us see one by one. Administrative role, development and implementation of drug formulary service. So I'll talk about hospital formulary later on in my lecture. I have taken these from this article. Second administrative role is attendance at non-clinical meetings, that is drug and therapeutic committee. I will also talk about drug and therapeutic committee in my lecture. Then conducting quality assurance measures, that is drug usage, evaluations, workload documentation, auditing, etc. So these are quality control related activities. Then management of the drug budget, then evaluation, selection and purchasing of pharmaceuticals for the unit, then development of drug policies, protocols, guidelines for the hospital. In this article, they talked about NICU. Then this is from same article. Clinical roles include patient medication chart review, participation in medical ward rounds, monitoring the efficacy of pharmacotherapy in patients, documenting, monitoring side effects and adverse drug events or reactions, documenting medication errors, evaluating patients' clinical laboratory tests, therapeutic drug monitoring, immunization, monitoring total parenteral nutrition, participation in clinical meetings, calculating and recommending doses and dosing schedules for specific patients, assisting doctors in prescribing off-label unlicensed medicines, identifying and performing interventions for individual patients to prevent or resolve drug therapy problems, example, interactions, incompatibilities, allergies, recommending drug and contributing to the pharmacotherapy decision-making process for specific patients, collaborating and discussing specific patients with doctors and nurses. So these are educational roles, providing training and in-service for other health professionals in ICU. In neonatal ICU, because I've taken these from a pediatric article, contribution to and attending NICU related conferences, involved in clinical trials, involved in research related to neonatal pharmacotherapy, sources of drug information, that is, responding to information requests from health professionals on the ward, counseling parents or carers of neonatal patient on medication. Then provision of medicine, and these roles include dispensing prescriptions, extemporaneous compounding of formulations, stocking the ward for essential medicines, housekeeping activities, that is checking expiry dates, freeze temperature, etc., preparing unit doses for parenteral and oral medications. Then let us see what are various Indian acts relevant to hospital pharmacy. First one is Drug and Cosmetic Act and Rules. So Drug and Cosmetic Act came in 1940 and rules came in 1945. These are to regulate the import, manufacture, distribution, and sale of drugs and cosmetics. It includes drugs of alternate system of medicine. Drugs and Cosmetic Act and rules comprise of various schedules. Definition of allopathic drug include all substances excluding food intended to affect the structure or function of human body is a drug. It includes contraceptives and insecticides. So drugs are, as per Drug and Cosmetic Act, scheduled and non-scheduled. So organization as per Drug and Cosmetic Act. So there is a Central Drug Standard Control Organization or CDSCO, which has 6 zones. I'm sorry, this should be read as 6. So it is under Directorate General of Health Services, Ministry of Health and Family Welfare, Indian government. It has 6 zonal offices, 4 subzonal offices, 13 post offices, and 7 laboratories across the country. CDSCO is responsible for approval of drugs, conduct of clinical trials, laying down of standard for drugs, control over the quality of imported drugs in the country, and coordination of activities of state drug control organization by providing expert advice with a view to bring about uniformity in the enforcement of the act. Then there are state drug controllers. Then there are various testing laboratories. Then next act is the Pharmacy Act. It came in 1948. According to this act, drug can only be prescribed by a doctor. It is administered by a nurse, and all other drug related activities are done by a registered pharmacist. And as per this act, pharmacists are registered in State Pharmacy Council. Basically, Narcotic and Psychotropic Substance Act and Rule. It covers purchase, transport, storage under lock and key of narcotic and psychotropic substances to be carried out against permit from Excise Commissioner. Then the Medicinal and Toilet Preparations Excise Duty Act and Rules. It came in 1955. The Act provides for the leeway and collection of duties of excise on medicinal and toilet preparations containing alcohol, coca derivative, opium, or other indigenous intoxicating plant derivatives. Then let us see structure of pharmacy in hospital. So pharmacy can be central pharmacy, OPD pharmacy, inpatient pharmacy, floor or ward pharmacy. Then flow of drug. Drug is either stored in a separate drugstore or it can be stored in the pharmacy itself. So if it is a store which is separate from pharmacy, then there is a concept of inventory. Supplier supply drug in the store and there is inventory management. And in such a scenario, pharmacy also receives certain drugs as a concept of just in time. Then the drugs are dispensed from pharmacy. So let us see about drugstore and let us see about pharmacy. So drugstore. Location of drugstore, it should be easily accessible to supplier. It should be away from heat generating sections of the hospital like laundry and CSSD. It should have 5 to 6 partitions. It should be air conditioned, well lit, dust free, neat. I am sorry, this is neat and tidy. There should be fire extinguishers available. If in basement, there should be proper drainage. Then office of store in charge should be near the entrance, and it should have a walk-in cooler to store drugs at lower temperature. Then it should have one or more registered pharmacists and various helpers to carry out activities of storing drug. Functions of drugstore include receipt of drug after thorough inspection. This is very important. Drug should be inspected thoroughly while receiving from supplier. Then storage of drugs in proper environmental conditions so as the drug retain therapeutic efficacy, and maintenance of life register of each drug and disposal of expiry drugs. So these are functions of drugstore. Then about OPD pharmacy, it should be located on ground floor. It should be near OPD and it should be close to natural exit of the hospital. Pharmacy have following subsections: manufacturing area. These are minor procedures after receiving drug. Pre-packaging, store area, dispensing area, and office area. Total requirement is 4 to 5 square feet per bed of the hospital and one OPD dispensary window for every 200 OPD patients is required. It should have a chief pharmacist. Chief pharmacist should be postgraduate in pharmacy with 3 years experience. It works under direct control of medical superintendent. Then there are one or more registered pharmacists. Then there are packers for pre-packaging. There are typists and clerk, and there are attendants and sweepers. So this is staffing of hospital pharmacy. Functions of hospital pharmacy include storage of drug, dispensing of drugs, quality control of entire process. Then how to avoid pilferage of drugs. So these are various guidelines. One is strict accounting of category A drugs, internal audit at regular intervals, surprise check of stores, periodic transfer of pharmacists. Then pharmacy management at hospital level. So there are pharmacy and treatment committee and hospital formulary. So let us see pharmacy and treatment committee. It acts as an advisory body to hospital on the matters pertaining to drugs. Its functions include advisory service, objective evaluation of clinical data pertaining to new drug, develop hospital formulary, develop plan for education, training of staff and students, review reported adverse reactions to drug administered, and conduct prescription audit. So these are functions of this committee. It is at the hospital level. So composition include medical superintendent, head of the department pharmacology. If not available, then head of the department of medicine, then nursing superintendent, head of pharmacy as a member secretary. Then hospital formulary. Hospital formulary is a booklet listing the drugs approved by pharmacy and treatment committee for use in the hospital. And contents of hospital formulary, details of hospital pharmacy and treatment committee, detail of drugs including name of drug, dosage of drug, regulations, incompatibility, treatment of acute poisoning and side effects. Various guidelines for making hospital formulary. Drugs of secret composition should not be included. Combination of drugs to be avoided. Preferably list generic drugs. Revised at least once a year. Physicians can prescribe drug other than listed in formulary. They can prescribe those drugs in emergency and with proper justification. Then various matrices and KPI. So these are the various domains I have taken from this publication. One is patient experience domain, where standard one is patient focus. Then standard two is episode of care. Standard three is integrated transfer of care. Then domain 2 is safe and effective use of medication. Standard 4 is effective use of medication. Standard 5 is medicine expertise. Standard 6 is safe use of medicines. Standard 7 is supply of medicines. This includes dispensing, labeling, distribution, storage. Then domain 3 is delivering the service. Standard 8 is leadership. Standard 9 is governance and financial arrangement. Standard 10 is workforce. So this is a classified listing of various matrices which can be derived from these standards. Then clinical pharmacy key performance indicators. These can be classified as medication reconciliation on admission, pharmaceutical care plan, drug therapy problems, interprofessional patient care rounds, patient education during hospital stay, patient education at discharge, medication reconciling at discharge, bundled patient care intervention. I have taken from this article. Then the key performance indicators can be divided into structural indicators, process indicators, and outcome indicators. So these are structural indicators which include manpower and facilities, environment and resources. I have taken from this article. Then these are process indicators. Then these are outcome indicators, and most of them has already been discussed in my lecture. And the others include incidence of neonatal sepsis, medication error rates, reports per 6 months, adverse drug events or reports per 6 months, and cost of therapy. Then finally, this is from NHS Foundation Trust. These are very few KPIs, but important one. That is number of external dispensing errors reported, number of dispensing errors prevented, that is near misses, number of medicines information queries completed, percentage of medicines reconciliations completed within 72 hours, percentage of charts with level 2 pharmacy checks carried out, number of complaints and compliments. So this is all for today. Thank you very much.